Will I be able to golf after my procedure? That's a loaded question. So I'll tell you, golfing after your procedure will depend on what procedure you had, what the pathology was. Did you have an isolated labral tear? Did you have an isolated rotator cuff tear? Was it a full thickness tear? Was it a partial tear? Did we use biologics such as cell-based bone marrow, which contains stem cells, and or did we use PRP? So all of these things are factors that would be very much individualized to you. And then as you're going through your therapy, we're also continually making assessments on your performance to figure out if you're ready. Okay. So I had a patient recently that had a pretty severe tear, and it was actually a full thickness, partially retracted, and really needed the full gamut of what we could do. And essentially went in there with cellular content and lots of rehab in terms of building on that. And admittedly, it was several months before we recommended going out and playing golf. But that's in a pretty significant, tear. That's a patient that had they had a surgical procedure, in all likelihood, they wouldn't have been released to go play golf at least for 6 months. So if you're talking, hey, we may be able to get back to, starting to hit balls and things in a matter of a few months, that's a pretty decent trade-off. Not to mention the amount of time that you're not in a sling and all of those things. So, so you really have to look at it case by case. I hate to just make a blanket statement. Sure, you can play golf after your procedure. We do have many patients that play golf, but it's a question of what did they have done? How bad was their shoulder? And I tell patients that it's pretty rare for me to see somebody with just one small thing wrong. If you come in, you've got isolated partial tear, we've seen patients, come in and have a PRP injection, and they're back to their activity of choice in a matter of 4 weeks to 6 weeks, and I fully release them back to doing what they're doing. And sometimes they jump the gun on me because they feel so good, and so I don't recommend that. But it's one of those things that sometimes it happens because they recover so much more quickly. Okay,